morning and welcome to Health on Traxx on the beautiful looking Monday, the 23rd of September 2024. Bulan Malaysia Sihat Sejahtera is the topic that we are talking about today with our guest, Mr. Wan Azrin Izani bin Wan Mohd Zain, who's the Senior Assistant Director at the Ministry of Health. Now, before we start, let me just say, Bulan Malaysia Sihat Sejahtera, one of the initiatives under the National Healthy Malaysia agenda organised by the Ministry of Health to realise the government's desire to promote healthy lifestyle using a whole-of-nation approach. The Malaysian Healthy and Prosperous Month is celebrated every September each year. Good morning and welcome to the studio. Mr. Wan, how are you today?
I'm okay, I'm fine, I'm healthy.
All right, so it's a healthy time for a healthy month.
Yeah, sure. We need to show that, yeah.
Okay, Mr. Wan, can you briefly explain what is Bulan Malaysia Sihat Sejahtera, BMSS, and its objectives?
Okay, thank you, Mr. DJ. Bulan Malaysia Sihat Sejahtera, or we affectionately call BMSS, is an initiative under the Healthy Malaysia National Agenda or Agenda Nasional Malaysia Sihat, ANMS, which aim at realising the government's desire to cultivate a healthy and well-being of the Malaysian population through a healthy lifestyle culture and with a whole-of-nation approach. So BMSS aims to strengthen cooperation among strategic partners, where all parties, including strategic partners from various government agencies, private sectors, NGOs, as well as health volunteers, the media, and community to work together in planning and implementing integrated and widespread healthy lifestyle activities for the well-being of Malaysians. So BMSS is celebrated to realise this aspiration of creating a healthy and the well-being of Malaysian populace through the promotion of healthy lifestyles, enhancing public health literacy, and strengthening solidarity in health promotion through collaboration among government agencies, private sectors, NGOs, the volunteers and communities as well.
And what would be the main message domains focused on the implementation of BMS activities? So
the main messages will be conveyed through key activities such as the first one is the physical activity, healthy mind. We know the increasing prevalence of mental issues among Malaysians, mental health issues among Malaysians. Thirdly is the healthy eating and safe nutrition, which is a big problem in Malaysia. The fourth one is the prevention of risky behaviours, and lastly is the hygiene and health issues. So we hope with all these activities can improve the health literacy among Malaysians, and thus practicing healthy lifestyle towards wellness for healthy Malaysia as a whole.
Understood. So there is a very, very broad subject at play in this particular message domains. And you did mention about the National Health Literacy Policy, I believe. And can you briefly explain what is the National Health Literacy Policy, NHLP, and why is it important for our public health?
For information of all listeners of TRAXXfm, Ministry of Health Malaysia launched the National Health Literacy Policy or Dasar Literasi Kesihatan Kebangsaan on September 8, 2024. So the ceremony was graced by the YAB Prime Minister of Malaysia on that day. So why health literacy is important? So I would like to quote Sir Jackie Fisher, the first Sea Lord of the British Admiralty during before the start of World War I. He said that "Si vis pacem para bellum." If you want peace, you need to be prepared for war. So in order to get, if you put into the context of health and wellness among Malaysians, so if you want to get Malaysians to become healthier, so we must equip them with literacy, information, knowledge, and so on. So health literacy actually refers to an individual's ability to access, understand, evaluate, and act on health information he or she obtained. So it is important for public health as it enables individuals to make better decisions regarding disease prevention, health promotion, and their health care. For example, if someone learns about the importance of staying active and fit, so they may take steps like walking 10,000 steps a day to stay healthy and fit.
All right. Okay, that is one thing that I believe that I can do now, taking 10,000 steps a day. And I think even just walking alone, for those of us who are having such a tough time finding time to exercise, walking 10,000 steps, like literally in front of your TV, even works because a lot of people have access to what's it called? The walking pads nowadays. Right. Okay, Mr. Wan, what we're going to do, we're going to take a short break. We're going to listen to a song. This is a wonderful song, and we will be right back after this. If you do have questions regarding BMSS, Bulan Malaysia Sihat Sejahtera, that you would like to ask Mr. Wan, you can definitely do so via our TikTok page, right here on TRAXXfm. Welcome back, Dead or Alive. You spin me round like a record, baby. Right here on TRAXXfm. You are with me, KG, as well as our guest in studio today, Mr. Wan Azrin Izani, who's a Senior Assistant Director with the Ministry of Health. Now, Mr. Wan, why is it important to improve health literacy in Malaysia? What challenges are currently we facing in this area?
Likewise, I have spoken earlier, there are issues with not with the information that Malaysians have about health. Improving health literacy is crucial because the results from the 2023 Malaysia Health Literacy Survey indicates that 48.5% of Malaysians have sufficient but slightly in the moderate margin of health literacy, but are close to the minimum score, which is either limited or weak. So the data also shows that 27% of Malaysian adults have limited health literacy. Despite there are 8.1% decrease from 2019, the proportion remains the same, with 1 in 3 Malaysian adults having a limited health literacy. This highlights the need to enhance individuals' abilities to evaluate and make health decisions. So in health, we have what we call the infodemics, the information epidemics. So this is quite a terminology that's quite popular during the COVID-19. We have a lot of fake news, misinformation, rumors, and so on, which hampers the government efforts to increase health literacy among the people. So this is the issue is not having the information. A lot of information is out there in many media, many platform of medias, but how the people translate the knowledge into action, and also how they perceive the information to improve their own health. So that's the issue.
Making sure they know the right thing and what to do with the right thing that they know.
True.
All right, and let's talk about the strategies. What are the strategies that you are using, and how do you use them to help improve the health literacy of the people?
Okay, when the National Health Literacy Policy was launched on September 8, 2024, the policy comprises of 3 main policy pillars. Number one is pillar number 1, development of health literacy competency, which involves integrating health literacy into the education system and enhancing health literacy skills among target groups such as the elderly. Pillar number 2, strengthening the health literacy ecosystem, which is focusing on reinforcing the ecosystem by providing access to quality information, which I have said before, quality information and relevant services. Whilst pillar number 3, strengthening health literacy governance, aim at enhancing health literacy governance at the national level and ensuring better coordination among agencies. So overall, there are 6 strategies and 16 initiatives under these 3 policy pillars outlined under National Health Literacy Policy.
All right, and one of the NHLP strategies emphasizes the integration of health literacy into the education system. Why is it important to teach health literacy skills at a young age?
Our youngsters is our investment for the future. They are the future leaders of this country. So teaching health literacy skills at a very young age is critical, as young individuals who are proficient in health literacy are more capable of leading healthy and quality lives. So they are easily, you can change their behavior rather than people like us, 40 years and above, you see?
Yeah.
So it's easier for them to stop smoking rather than people like us to stop smoking, lock, stock and barrel. So that's the analogy. So they can seek, analyze and understand health information, distinguish between facts and opinions, and identify trustworthy sources. So this help them to make informed health decisions by considering the risk, benefit and personal value. So that's why it is important for us to invest in health literacy among the youth in the education system.
And even for us, like you said, smoking, right? It's hard for us to start, but for them, it's even better if they never start at all.
Sure, that's true.
Right, and that is something that can be gained through health literacy. Okay, we're going to be taking another short break right here on TRAXXfm. We will be back in just a few moments. We are with Mr. Wan Azrin. We are talking about Bulan Malaysia Sihat Sejahtera. Now, he is a Senior Assistant Director with the MOH. We will be right back. Don't go anywhere. Welcome back, and you're currently with us. We are currently talking about Bulan Malaysia Sihat Sejahtera with our guest, Mr. Wan, who's the Senior Assistant Director of the MOH. Now, Mr. Wan, how does NHLP plan to enhance the health literacy among the youth, and what specific initiatives are being provided for this particular venture?
Okay, the policy plans to enhance health literacy among the youth through integration of health literacy in the education system. So this includes incorporating health literacy skills into the educational curriculum and also providing relevant learning materials. And we have a lot of information in the curriculum, the textbooks and so on, and as well as the extracurricular activities such as the Young Doctors, ProSIS, program Siswa Sihat, and so on. So additionally, there are health awareness programs designed specifically under Agenda Nasional Malaysia Sihat or Malaysia National Health Agenda to help the youth to better understand and practice healthy lifestyle with more sustainable and healthy behaviors.
Absolutely. We have to target the youth. As you said, they are the leaders of our country in the future.
Yeah.
And there is another initiative, I should say, Putrajaya Sihat Sejahtera. What is this initiative or program about Putrajaya PSS?
So Putrajaya Sihat Sejahtera, if you look into the umbrella of Malaysia National Health Agenda of NMS, we have BMSS. We have the National Health Literacy Program. There's another initiative under Malaysia National Health Agenda. And also we have Putrajaya Sihat Sejahtera. So Putrajaya Sihat Sejahtera is one of the initiatives under ANMS aimed at reducing prevalence of health risk factors specifically targeted at public servants living or working in Putrajaya. So the public servants must walk the talk in terms of practicing, inculcating the healthy lifestyle into their daily lives and working lives. So we are talking about the work-life balance and so on. So the objectives of the Putrajaya Sihat Sejahtera is firstly is to implement is the implementation of policies, health in all policies related to the culture of healthy living and health supporting environment. So that's important. Secondly is improvement of health literacy. We are talking about health literacy among youth, about the vulnerable groups, and the most important thing about public servants, they must also improve their health literacy among themselves. And thirdly is the enhancement of healthy living practices in the workplace. So we must reduce the intake of sugar. We must take 10,000 steps, reduce the using of elevators and so on. So we take the staircase and so on.
I mean, as you said, they are very simple steps that you can take, but these are steps that need to be taken nonetheless. Like for instance, rather than the elevator, use the stairs instead. Yes, and that would even help in your quality of life after that. And how did this initiative come about? What would be the focus as well as the initiatives that are being implemented?
So actually, the recent findings from the National Health and Morbidity Survey in 2020, conducted in 2023, shows the alarming situation, especially it shows 61.2% of adults in Putrajaya are experiencing overweight and obesity.
Oh no.
That's quite surprising.
Okay.
I'm working in Putrajaya, so far exceeding the national average. So this is quite alarming. So moreover, 34.6% of adults in Putrajaya also having high blood cholesterol or hypercholesterolemia compared to the national health prevalence. And 35.5% of adults in Putrajaya are also found to be inactive, more than the national average. So albeit having more parks, more recreational areas, but there are still more than 35% of adults in Putrajaya are found to be inactive. So that's quite surprising.
Understood. All right, so Mr. Wan, we are actually at the end of our interview for today. Very, very fast one today. I think you've already touched upon everything that we can talk about, which is the BMSS, the PSS, as well as the National Health Literacy Policy, which I believe is one key for us to become a better, fit nation All right. Before we end, Mr. Wan, any message or information that you would like to convey to our audience?
So we would like, we in KKM, in Ministry of Health Malaysia, would like to invite all Malaysians out there to come and join the celebration of Wellness Month and also the launch of Putrajaya Sihat Sejahtera from September 26 to 29, 2024, which will be officiated by YAB Datuk Seri Dr. Ahmad Zahid bin Hamidi, Deputy Prime Minister of Malaysia, at Dataran Wawasan Putrajaya. So there are various interactive and fun activities will be available for visitors. We are talking about the youngsters, we are talking about those nobody must left behind in health policies. So there are many activities available for the visitors. For example, fun run, neon Zumba, full style challenge, and many more. And there are also celebrities and influencers will be joining, and I hope you will be joining us also in Dataran Wawasan. So there are celebrities such as Bel Ngasri, Atu Zero, Aceh, Mek Yun, and many more. So don't miss out this event, and come and have more information about health literacy and Bulan Malaysia Sihat Sejahtera, and celebrate the launching of Putrajaya Sihat Sejahtera.
All right. Thank you so much, Mr. Wan, for your time today. We hope you have a good day after this. Back to Putrajaya for more work, since this program will take all of the hands on deck. And with that, it's about time that we end our interview for today. I'll be back after the news, so don't go anywhere. You're currently listening to Traxx.